So we discussed so many things last time you were on our podcast. Thank you. And you gave me so many referrals to other podcast guests. I thank you for that. I'm always looking for um, people to share the word and educate and empower individuals to take charge of their own healthcare. So, but this time, let's talk about direct primary care and how it can prevent mass shootings and suicides.
Yeah, you know, I just published an article this morning on medium.com about this subject. And the article stems from personal experience. On June 31st, my youngest nephew committed suicide, which shocked the family, as it does most families. And it was quite a gut punch. And usually you ask why a lot. And this was out of the blue. This was similar to physician suicides, where it's a snap decision. There was no end-of-life plan. There was no real telltales of what's going on. But he committed suicide, and I got a text message the next morning from my oldest nephew, Jason, and the text message began with, "Did Mom reach out to you last night?" And I knew right away, something's not right, that he just doesn't do that. And I said, "What happened?" And he said, "Patrick is gone." And I thought, oh God, why? So anyway, that's how the article begins. And about 4 days later, July 4th, Highland Park, Illinois, was the scene of a targeted mass shooting. A young guy acted out on his disturbed thoughts and killed and wounded a lot of people. And as it so happens, my parents grew up in Highland Park. They lived there for many years, and I grew up 4 suburbs south. So this was yet another gut punch. How on earth could that happen on Chicago's North Shore? All my North Shore friends were like, "How the heck does this happen?" And you've heard this in other mass shootings, the same comments. How does this happen here? So I started thinking a few days later, there are things that were kind of roaming around in my head, and I was connecting dots. And the article is actually a way for me to process and work through it. And something my dad used to tell me a long time ago, his son, when something bad happens, ask yourself what's good about it. Well, there's nothing good about these things, but I refined that question to what good can come from it. And there were things that I knew from a long time ago, conversations with physicians, experts about primary care and how things work in the right system. And I remember after a school shooting back in, I think it was 2015 or 16, somewhere along those lines, maybe it was 17, I wrote one of my medical mentors, Dr. Steve Schimpf, who wrote Fixing the Primary Care Crisis, an excellent book. And it's one of the first that I recommend, even over my book, The Expat Health Guide. And I asked Steve, we'd already conversed about direct primary care and how good it was. He has it. I mean, he has it up there, which is, he loves it. And this is a man who is the CEO of the University of Maryland's Medical Center. So he's seen both the care side and the admin side, so he knows what he's talking about. And I made the observation, I wanted to hear his thoughts, that with today's broken primary care system, primary care doctors don't have the time to do what's necessary just to listen to the patient, get to know them. They don't have the relationship either. It's take a number. And I said, that can't be good for screening people with mental health issues and behavioral health issues. We've lost an incredible tripwire in over decades of primary care being cannibalized. And he wrote back and he agreed. He said, yeah, it's quite easy for primary care doctors to pick up on things if they have the time and the relationship and that trust factor. And that's when I knew something, we have a big element missing. And so the article was designed it's more of a short course. It's not a typical 5-minute medium.com article. It's about a 20-minute read. But in there, I give the backstory of what happened, because it's important to understand what happened to primary care over these many decades. And it used to be that primary care docs were family docs, and they knew the family. They knew the interactions. They could tell the parent of a child, I think we need to keep an eye on Junior here. Or they could say to a husband and wife, things aren't looking too good for you guys. Your married life isn't as smooth as it should be. Maybe some family counseling here is good for you. And in today's system, you can just imagine, with 8 minutes and out the door, you can imagine the reception that'll get on the part of the patient saying, you don't know us, what are you talking about? And that's the exact point. They don't know you. And that's a sad point. So each of these events, the suicide, my Patrick's suicide and the Highland Park shooting, they both have timelines. And that's how detectives, you see them on detective show, how they establish who is where and what is what. And they only go back just so far. And the further back you go, the murkier it gets. And sadly, what's back there, and they converge, these two timelines converge at primary care, if you know what to look for. Because had both Patrick had great primary care, which he didn't, he was in the old system. And if this young kid, I'm not going to use his name, in Highland Park, had a better primary care relationship, the odds go way down that these violent acts, which both of them were violent acts, you stand a much better chance of reducing the possibility that they will act out on whatever it is going through their minds. So this is the issue, that today what we do is we focus on the weapon, we focus on the instrument of death. Let's outlaw them. Mm-hmm. And you hear both sides of the debate. And it's, we got to outlaw the assault weapons. And the gun owners will say, well, what about the person pulling the trigger? What about that? Guns don't pull triggers by themselves. What are we doing? We need more mental institutions. That's still a lot further along in the timeline. Okay, you're gonna put someone in an institution. Why not go further back in the timeline when you've got a way of dealing with it before it gets out of hand, before it becomes a big issue? And that's the point of the article, is really to say, you know what? Stop looking at this, at the immediate nature of things, and go further back. And I think long term, I know, and the doctors know, and the research, which I point out in the article, is showing a definite connection between better primary care and lower suicide rates, lower violent acts. So that was the purpose of the article, and I think something good came out of Patrick's death, and it was a little bit of catharsis for me, because this has been rolling around in my head. I've known this for a long time. There's a connection, and every doctor that I talk to, every direct primary care doctor that I talk to, same thing. Whoops, had a little power interruption there. So the internet's great, but the power goes out.
Right. Not so stable.
So the connection's there, and they all say, oh yeah. The DPC docs all say, it's so easy for us. It's so easy for us to see it, because as long as you have that relationship over time, it's not an immediate thing. This is not an immediate fix-it thing. This is over time. And once you get that sorted, we know the other benefits to primary care, great primary care, which delivered by DPC enables all the benchmarks for outstanding care. I smile, and you smile too. I know you do, because you can see what's in front of us. You know what's possible, and that's a good thing, as Martha would say.